Hello again, I'm Dr. Nunez with Living Health. This is a series of videos on how lifestyle can impact your health. These are things that you can do on how you live your life, decisions you make on a daily basis that impact your health. Believe it or not, you have a lot of control over the state of your health. It's estimated 80% of chronic diseases are influenced or can be managed or can be reversed by lifestyle interventions. Today, I wanted to talk to you about the latest recommendations from the American College of Cardiology, and I'm going to link to them below, and I'll read some of the passages in there for you. They make recommendations on lifestyle and nutrition and exercises and the like. And I'll give you some of my comments about these. If you like these kinds of videos, press the thumbs up, press the subscribe button, and press the little bell so you can be notified in the future of the upcoming videos. So, the American College of Cardiology, they just published recent guidelines on that they updated on people with elevated triglycerides. So this is a population of people. Triglycerides are a kind of fat in your body, and usually when your doctor orders what's called a lipid panel, in there's that cholesterol, and in there are the triglycerides. And people that have high triglycerides also have certain risks for what's called ASCVD. And if you look at the article link, what that means is atherosclerotic cardiovascular disease, ASCVD. So when they refer to those initials, that's what they're talking about. So let me read to you just on their position paper. The document emphasizes that lifestyle intervention, including adherence to a heart-healthy diet, regular physical activity, avoidance of tobacco products, limited alcohol consumption, and maintenance of a healthy weight remains a critical component of ASCVD risk reduction, both before and while patients are using lipid-lowering medications. So what does that tell you? It tells you that even though you might be on one of these drugs called statins, or you're taking your omega-3s, supplements, or prescription omega-3, you need to look at lifestyle. Okay, let's talk about that. Tobacco, definitely a priority. If there's one thing that you are doing, if you are smoking, that pretty much is the number one priority for you, is to stop smoking. Smoking's been documented to be a huge risk factor, not just for cardiovascular disease, but also for cancers and the like. So if you are a smoker, that may just be your number one priority in terms of lifestyle. Try to figure out a way to address that, and there's national hotline, I'll link to it, on stopping smoking and things that you can do and recommendations you can do for that. Now beyond that, what else do they talk about here? Limited alcohol consumption. Okay, well, what is limited alcohol consumption? If you are an alcoholic or suffer from alcohol use disorder, it's best simply not to drink alcohol, to abstain, okay? And I'll highlight that. If you have issues where you can't control yourself when you're drinking alcohol, or you're a binge drinker, or when you're not drinking, you're obsessed with the idea of getting that next drink, alcohol is not for you, okay? So I want to highlight that. If you have an alcohol use disorder, and you can Google all those guidelines on what that is, or alcoholic, abstinence is the way to go. Okay, now we'll set that group aside. Culturally, there are large groups in the world that do drink regularly. They might have a glass of wine with their meal, and that's their custom, and they don't have an alcohol use disorder, and they're not alcoholics. But it is something that they enjoy as part of their lifestyle, and that is fine. That is fine. In fact, there's data and the guidelines here that you can Google on from the American College of Cardiology does show if you're a male, their recommendation is up to 2 drinks a day, 14 drinks a week. And if you're a lady, 1 drink a day, 7 drinks a week. There are other studies out there, and you can see that there may be some benefit, some health benefit for those people that don't have issues with alcohol, of drinking somewhere even as many as 21 drinks a week, which would be 3 drinks a day for a man. That might be some benefit in there of what they call small amounts to moderate drinking. I don't want to encourage drinking. If you do not drink, you should not take up drinking. Okay? If you're an alcohol use disorder issue, don't drink. If you are an alcoholic, don't drink. If it is part of your culture and it is what you're used to within the lifestyle of your culture to drink moderately or small amounts, you might enjoy a glass of wine with a meal or something like that. It is okay, and it may have some health benefits. Okay, we'll go out there and say that too. What else is on their little list here is health maintenance, health weight, a healthy weight. Well, according to the guidelines, a healthy weight, that's a difficult one to address many times, because we've been for a long time using the body mass index, which has great benefits for when we're doing population studies. It's easy to measure. It's something you can see across a population and the like. And yes, according to those guidelines, and that's what it's based on, body mass index of 25 is the limit of what a normal body mass is. Between 25 and 30 is considered overweight. Once you get past 30, they define that as obesity. So when you look at all this data out there, or news stories or journalism, and they're talking about weight, that's what they're talking about, body mass index. At least in the United States, that's what they've been talking about. Now, having said that, yes, there are some caveats about body mass index. It doesn't apply to everyone. If you're a bodybuilder, for instance, you may have a rather high body mass index, but it's not necessarily as unhealthy as, for instance, somebody who carries their weight around their belly. In those cases, yes, waist circumference is something to look at. If you're a lady, 35 inches. If you're a man, 40 inches. Or the limits of beyond that, those are risks to your health, to cardiovascular, blood pressure, and the like. So if you can get that down, it would be of benefit. There are some genetically, and we don't know all the details about how to manage weight yet. It's being worked on. We don't have a magic bullet to resolve weight issues. But if you can knock the weight down a little bit, if you are in those categories where you're a little heavier, that tends to be of health benefit. So how do you do that? Generally, we've been recommending the plant predominant diet, which does not mean veganism, does not mean necessarily vegetarianism. It does mean to make sure you're getting enough plant food in your diet, in particular fruits and veggies, in particular within those things that are not high in glycemic index. So within the plant world, you want to make sure you're not overeating fruits that are very sweet, be they oranges or pineapples or things like that. And within that you're eating the fruit, not squeezing it and drinking the juice from the fruit, okay? Because when you do that, you are processing it and concentrating the sugars that fruit has. It's better to eat an apple than drink apple juice, okay? Actually, drinking apple juice may be something you want to avoid. It's better to eat an orange than to drink orange juice, okay? That's the kind of thinking we have to get into. You'll get your fiber by eating the fruit. You'll probably get rid of the fiber if you drink the juice, and you're concentrating the sugar. So don't do that. Within the veggies, the root vegetables that are very starchy, you have to be careful with. The body converts that a lot to sugar very easily. So it's better to stick to your greens, your legumes, which are beans, lentils, those kinds of things. And then in the grain world, best to go with the whole grains, because you're going to get more fiber, you're going to slow the absorption of the starches in those, and that will help you too. And then within the dairy world, yes, it's probably something to limit as much as you can, especially full fat dairy, to bring that down. And they talk about that in these studies. Now, there are many different diets out there. You're gonna find something that you can live with, that you can feel comfortable with, that's culturally sensitive to the way you live and the way you're used to living, to do that. And again, all these things, take some of these diets that are out there and dietary recommendations that are very rigid with a grain of salt. You need to live your life. You need to feel good and enjoy living your life. That's an important component, because then the other big thing is that stress, right? And if you're not enjoying life, not enjoying what you're doing, not enjoying the way you live, that can be a stressor for you. And stressor can impact as a risk factor then. So be careful, try to eat healthy. And the other point here that they make is healthy weight. And that's it in that line that they talk about. But inside they'll talk about, in the bigger study, you'll see a table 4. We'll talk about more in-depth detail on which nutritional components to avoid, which to emphasize. In general, if you're eating of the fishes, of the meats, fish is going to be the healthier component to include in your diet, as opposed to red meat, which is going to be high in cholesterol and has no fiber anyway, and has a lot of fat usually. So those are things to avoid in that area. And then physical activity. Physical activity, if you could build it into your regime, into your routine, will help you manage all of these risk factors and keep you more fit the longer you are for your enjoyment. So I'm going to leave it there, and I'm going to leave some links below so you could look at and examine on these studies that I'm talking about and what to do as you go forward. Again, lifestyle. The choices you make, believe it or not, every day on how you live your life impact greatly your state of health and your ability to enjoy life. So give it some thought and apply yourself. You can do it. Don't get frustrated by any of these kinds of things or recommendations. You can do these things one step at a time and improve your health. If you like these kinds of videos, press the thumbs up, press the subscribe button, and press that little bell. And until next time, I'm Dr. Nunez. Bye-bye.